Hi everybody, Barb Anstead here, natural nutritional clinical practitioner. And throughout the month of September, you've probably checked out some of my other videos regarding digestive health. A lot of that has been to do with bathroom habits, and which is your lower gastrointestinal tract. We're going to talk today a bit more about the upper GI. And the reason for that is because up to 70% of people suffer from something called GERD, which is gastroesophageal reflux disease. And with this, a class of drugs called PPIs, and that's proton pump inhibitors, are prescribed. That's a very common prescription from physicians and one that they're typically quite comfortable in prescribing. But the usage of that particular league of medication through different modifications to diet and lifestyle can often be dropped down to about 10%. And that's a really important thing to do. The reason for that is because the problem with those medications is they can reduce your ability to absorb different nutrients, and some of those nutrients are B12, your calcium, magnesium, and the critical roles of those for helping prevent osteoporosis, to reduce anemia. Magnesium has over 325 different functions in the body, so you can understand that a medication that possibly is reducing your ability to absorb those nutrients is also going to eventually contribute to other issues with your system. So there's a reason why I'm quite passionate about this particular topic, and I know some of you already know that I had lost my sister Kathy to colon cancer many years ago, and she was prescribed different proton pump inhibitors prior to her diagnosis, and she was otherwise a really healthy person, but sometimes she would awake in the morning and just have a little bit of a cough, and knew that it wasn't asthma. She didn't actually present with acid reflux, but when she went in and finally had an endoscopy, she had really severe gastroesophageal reflux disease. And the reason that doctors prescribe for that is because if we don't treat the symptoms of that disease, because stomach acid is so caustic, it can actually cause esophageal cancer. So it is something that needs to be dealt with. But from a holistic perspective, we don't want to just put band-aids over things. We want to know why this is happening. So there are many things that can be going on. There can be many food triggers. Stress is definitely a huge proponent. There can be a problem with the lower esophageal sphincter, also known as LES, and that's allowing stomach acid to come up. It's always important that you get a proper diagnosis and that you're seeing the proper healthcare professional to diagnose what the issue is before you start taking measures to treat that. But, as far as how caustic that acid is, it also has a role to play in our immune function. Okay, it can stop different viruses and bacteria in their track. And so if we are reducing it to about 10%, which is what a lot of these medications do, then we're inhibiting the proper reign of good bacteria throughout our system to support that immune system throughout the intestinal tract. Remember, 80% of your immune system is there. So if we have, very few good bacteria and a lot of bad bacteria with free reign, then we have other problems going on. But, some of the things that you might look at if you're suffering from gastroesophageal reflux disease is not just doing that band-aid approach. Talk to your healthcare professional about different measures that you might be able to take to reduce your reliance on those medications. Look at different lifestyle strategies that may help reduce your stressors. I will send out or post an article that talks specifically to the different types of foods that perhaps you could be reducing or avoiding, and some other measures. But, there are herbal supplements out there that are options that help protect that mucosal lining. And some of those are marshmallow root, not the ones we roast by the campfire. It's an actual herbal, which is incredibly healing and soothing to that mucosal lining. There's also slippery elm. We have to look at whether we're getting enough fibers in our diet, and the proper form of fibers. Again, we go back to the probiotics. And so there is a lot that we can be looking at. But proton pump inhibitors are the third most prescribed medication, just below thyroid medication and statin medications. So, I am a huge proponent of looking at the why, not just taking a prescription to cover up the symptomology. We need to find out what's driving that condition within the body, and then if we have the tools and the resources and we're educated and empowered, we can be making different decisions to support our health. So look forward to those posts, and please feel free to reach out and ask questions. I'd be really interested in speaking to your exact problems and seeing where you can go from there, and what type of practitioner maybe you should be looking at, or therapies you can be including in your life. But it is something that we need to pay attention to. There are far too many people just taking these prescriptions and not understanding exactly what it is doing to their body for their long-term health. So thanks for listening, and we'll talk to you soon. Bye.